Dr. Kevin Hoffarth, BioFIT Medicine, Austin, Texas, here to help you transform your body as well as your health at the same time. So, can't start with this without talking about food and your diet and how confusing this topic is. Shoot, if you grew up in the 70s and 80s like I did, man, you were hearing about the pyramid diet and then low-fat diet and then non-fat diet. Now fat's not bad. And then paleo diet, and then ketogenic, and then intermittent fasting, and carb loading. Oh my gosh, this could give you a headache. And it does for everyone, including physicians. So what do? Well, I have come up with 5 steps to help you personalize your diet that works for you. Look guys, one size does not fit all. If you have someone who's always saying, hey, this one particular diet worked great for me, it may not work well for you. Remember, we all have 7 core physiological pathways that our body must go through. The starting point is digestion and assimilation, but how our body digests and assimilates and then takes that food or information and moves along in those physiological pathways differs from person to person, and it depends on where your starting point is. So, what's our starting point? This starts with number 1. You must know exactly what you are trying to do. What's your goal? Are you trying to have a bikini body? Are you trying to have an athletic build or super muscular? Or could you care less and just say, I just want to be healthy? You need to talk to your provider and also have a clear picture in your own mind of what your goal is. Because if you don't think the diet choices matter depending on your goal, then we've already lost you. Number 2, okay? We need to know where you're starting from, and we need facts. And this is why I use a DEXA body composition scan. This tells me gram to gram, fat to muscle, and how it's being distributed throughout your body. If you're distributing heavily in the android body composition area, which can be basically fatty liver area, then that tells me a lot about your diet, your hormones, your lifestyle, and it helps me guide me in the direction of what might be the starting point for the best dietary design for you. Number 3 is biomarkers. Now, biomarkers tell me at a cellular and biochemical level how your body's doing from, say, an inflammatory perspective. Again, guys, food, how it interacts with the body, it depends on person to person. We're always hearing about inflammatory foods if you read about this a lot. However, what may be inflammatory for one may not be inflammatory for another, and frankly, it's not. So again, if someone is, say, I only want plant-based versus, hey, I live in Texas and you're not gonna get rid of my meat, look guys, it can actually, both can actually work. So again, biomarkers. Number 4. Now, this is actually one of those areas that gets almost never discussed, but it's the first question I ask a patient in my follow-up. And I ask them, I say, how are you feeling? Now, if they're saying, hey, I feel great, then we're probably doing something right because their body is functioning probably optimal. However, if they're having, say, digestive symptoms, or within 1 to 2 hours of a meal, they're saying, hey, I feel tired, or I just don't feel right, they may be having food sensitivities. So be aware of how you feel after a meal, especially within about 1 to 2 hours, can enlighten you of what the foods that may work best for you. And finally, number 5. Now, it's important that you recognize that for sustainability, it must fit into your lifestyle. I can't emphasize this enough. If this doesn't fit into your world, it's not the right diet plan for you. So I work with a lot of, say, international travelers, and they're working with different cuisines throughout the world, throughout the year. And so I need to give them templates to help them work through this. For other people, it's not as difficult. Maybe they can eat the same thing every day like I can. But it varies from person to person. It's got to fit your lifestyle. And that's why, say, for one person, an intermittent fasting might work great for someone who's busy, And for another person, they're like, this isn't sustainable, or I'm super active, I'm athletic, I just don't like this. It really depends. So in summary, the 5 things that you need to think about to personalize nutrition for you is number 1, you need to set your goal, okay? What are you trying to seek from a body composition standpoint? Number 2, your DEXA body composition scan. Number 3, your biomarkers. Number 4, how do you feel? And number 5, is it's meeting your lifestyle. All right, again, this is Dr. Kevin Hoffarth, BioFIT Medicine, Austin, Texas. Do me a favor, like this. If you do, I like likes. Please subscribe so you can see my videos each week, and then comment so that I know what you're thinking and I can help guide you. I will try to answer each one if I can. Finally, if you're looking to get more help, I am available via Skype, FaceTime, or phone if you don't live in the Austin area. I have patients all over the world. And yet, if you want someone locally, I encourage you to look for a functional physician. They understand both conventional and a functional approach. And there's lots of great physicians out there scattered throughout the country. Maybe go to Institute for Functional Medicine to help you find that. All right, I'll see you next week. Thank you for watching.